Because my head will remain like this. Like this.
And that's what the thing that was really
The camera like this. So my face is like this. You see?
So you can still keep your face down and it still shows very well.
That's what I'm saying. Now.
Can I say that?
YouTube video.
Glory. 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 Glory, can you hear me? Glory, can you hear me?
We can hear you now.
Can you hear me?
Meanwhile, my boy was there.
I hear you, ma. Good evening, ma.
Can I stay as a participant?
Yes, ma, you can. But you are. This way, ma.
She upside down, right?
Okay, so everybody can still hear me?
Yes, ma'am. Everybody can hear you.
Oh, I thought I was talking to just you. I didn't know everybody's hearing me. Ew. Okay. Hi, Bassant. How are you?
Good evening, ma'am.
Good evening. Hi. Same here. Good to see you too. Okay, so good evening all, and thank you for coming to the class. It's really good to have you here this evening one more time. As a way of introduction, today we are going to talk about, the whole class that we do every Wednesday is about ending our habits of health. It's always about election. What can we do better? What is our own medically guided contribution to healthcare? What can we do? Everybody's doing wellness differently, but are you doing it from the right source? Are you doing it from an approved source? So this class actually is a class, especially for those of you joining us for the first time, it's a class to teach habits of health. So in the past, we've been talking a lot of things as medicine. We talk about exercise as medicine. We talk about water as medicine. We talk about nutrition as medicine. We talk about all kinds of things as medicine. And we've turned everything into medicine. And so as part of what we teach every day, one of the things that we are going to stress on today, oxygen as medicine. So we're going to stress on oxygen as medicine, and nobody can do a better job on the subject matter of oxygen as medicine than the person that we are going to introduce to you. His name is Bassant. So you can actually mute out Bassant,
Yes,
and
ma'am.
then I guess you can get started. So thank you so much, everybody, for coming. I hope I was audible enough. Could everybody hear me?
Yes, we can hear you, doctor.
Okay. So I'm going to quickly hand over to Mr. Bassant. But Mr. Bassant is going to take you. I just want to recap. We practice as our habit of health, we own. You remember we own. R4, rest, E4, energy, O for
Energy.
oxygen.
Oxygen.
Abi? W
Yes.
for
Water.
O for
Water.
O for what?
Oxygen.
Oxygen.
Oh, for
Oxygen.
oxygen.
Exactly. So today we are going to focus more on the oxygen part of our wellness, okay? And for those of you just joining, I know that people are not ready to do the lecture until sometime around 8:05, which is now. So we brought in Bassant. Bassant is somebody I'd like to talk a bit about. If I had, I'm always high in energy, but if there's ever been a time that my body says, you know what, you need some rest, you need to do something, Bassant is the only person that I say I can allow to just make me do some breathing exercise, and either I pass out sleeping or I get super energized.
It's a
And
wellness talk.
yes, so he has actually taken people use oxygen and breathing therapies and stuff like that to get people out of wheelchair, to get people disease reversed, etc. He has done so much in the space of oxygen as medicine. And he has done a few lectures for us. So today I just thought, instead of me to be the person talking on oxygen as medicine, let me bring the person that I would even sit down and listen to on the subject matter of oxygen as medicine. And just remember, everything we are doing on this platform is just to equip us with tools and techniques to help us have a sickness-free body, live healthier, happier, and by God's grace, when God says we go home is when we go home, but we don't want to be a burden to anybody. We want to live a very healthy lifestyle. So Bassant, I'm going to allow you to introduce yourself and take over your presentation. Thank you so much for honoring.
Thank you so much, ma'am. Thank you so much. I really appreciate it.
Okay, no problem. Go ahead, Bassant.
Thank you, ma'am. Good evening, everybody.
Good evening.
My name is
Good
Bassant.
evening, Bassant.
Well, ma'am. So, my name is Bassant. I am from India as a yoga therapist.
Okay, Bassant, at some point, you have to mute out everybody. If not, there will be a lot of noise interference. Glory,
Yes, ma'am.
please you show him how to go to, let me see, you go to participant, and then there's some kind of a 3 dot. Then you have to participant, you see like 3 dots, says mute all.
Done now.
But how I know whether they are listening me or not?
They are listening to you, sir.
Okay, no problem. There we go. So I think all we said now. I cannot hear me.
You want me to unmute them?
Yeah. Don't mind.
Don't mind. Okay.
Yeah.
Okay, they can hear you now.
Yeah, yeah. It's still there.
Okay.
All
Okay, so you can speak now.
Well, once again, sorry for the interruption.
No problem.
Thank you. Thank you so much. So I'm a yoga practitioner from last over 45 years. And in this practice of my yoga in my life, I noticed one big thing. Nature is healer. Stopped what?
Nature is healer.
Yeah. So nature is the caretaker for every human, every body. And what is the nature belongs to? Air, water, fire. These three major elements we have in our body. Then another two elements called sky and earth. We are in between that. But we are always disconnected from it. We are living in urban life and bringing problem into the body. We are part of nature. So if we, as much as we connect ourselves with the nature, it will help us to be healthy forever. So oxygen, I mentioned number one. So oxygen, air, water, and fire. So without oxygen, water is no more water. I wish everybody know that. And without oxygen, you cannot light a fire. So you can understand what is the value of oxygen in our life. That's why if you are able to breathe deep inside from your belly button, not from the lungs, not from the chest, from the powerhouse, which is your powerhouse. And you may notice always children, which is belongs 0 to 12, they always use belly button to breathe, not lungs. By after age 12, it shifts from down to up. So please try to understand. Let me show you part of the body. See, as per nature, this part, all this part here, you can see this belongs to oxygen. This part belongs to water, and this part belongs to fire. So imagine if you are only breathing here, your stress level high. You cannot rest yourself. So air keep your head cool. Water will keep your stomach soft. And then fire will keep your legs warm. But in today's life, our head is hot, stomach is tight like a basketball, and legs are cool because no physical activity. And there are no need to do physical activity. If you really want to fit yourself, just oxygenate your body. Because you are breathing and you are living. But you are not living healthy life because you are breathing only here. If you breathe from here, you will see what you are getting it.
And he's doing it the same there.
From age 13 till end of the life.
The lady she was watching her movie in the house.
So you should try to understand if you are able to take your time 1 second for inhale or 2 seconds for exhale.
Glory, can you mute everyone, please? Glory, can you mute everyone?
He does not want. So let me just mute everyone so that we would have yes.
Glory.
Yes, ma. Network.
Network issue is a beer back. I think everything is clear now. Yeah. So I'm talking about this level. Okay. This level, all. Your nose is the resource of oxygen. Your nose help to balance your body temperature called 36, 37 degrees Celsius. And if you are not proper breathing, that temperature cannot be maintained forever. If the low means fever, if high means cold and cough. All these things, kind of sickness, you're not getting from anybody, you're getting from inside your own. So best way, inhale, exhale, and take your time and give your time. When you do heavy breath, deep breath, whenever you are doing some vigorous things, and then after one, when After breathing, you become normal. You are forget again proper breath from down here. So make sure as you are breathing properly, your head will be cool and you are having enough water, so your stomach will be soft, and then you are having proper time food discipline, so your food will be warm, not opposite life you are living. Your head will hot, stomach will tight like a basketball, and food will be cold, and you are getting sick, trying everything, and things are not working because your foundation of the body is your stomach. Even you are sick, you are taking medicine not going anywhere, still going to the stomach. So stomach will be cure always your problems. So let your stomach be soft permanently. And as much as you oxygenate, so oxygen wise, you are breathing. You see? So I am giving time to myself and I'm doubling my time for exhaling. That's all. It makes me always relaxed. It makes me always calm. So it will help you to sleep like a baby. And while you are sleeping, your body repairs. Remember my words. If you are sleeping disturbed, you are not able to say you are healthy. You are sleeping like a child means you are the best person on the earth. So before sleeping, if you are paying attention to breath, no matter how you are, where you are, even you eat your dinner on bed, lie down straight first, keep your hand on your stomach, 8 times. 8 times your breath is straight. 8 times. Then you turn on your left side, double your time, 16 times your breath while you are lying down on the right side. Okay, then turn on the left side, make 32 times. 8, 16 and 32. I'm multiplying one after one by 8. So straight line down, you are breathing from here 8 times. Then turn your right side, breathe 16 times. Then turn your left side, breathe 32 times. Before 32 numbers come, you already in different world. It means you are into the ozone. That's the value how oxygen can help you to cure your problems. Anybody having in the group who is into problem of blood pressure, stress, only one small thing called stress create these problems. And stress can be in everything. You are the one who holding stress, not somebody giving stress. You are paying attention on every single thing. Sometimes behave like a child. So that is only possible when you breathe properly, guys. Whenever, if you are struggling to fight with the high blood pressure, just block your right nose. Okay? And take a deep breath. From left nose. If you are able to make 50 numbers of breath, you can measure your blood pressure and do only 50 time breathe by your left nose. You will see remarkable change. Your blood pressure will come down and become normal. 50 number I am giving is just for beginning. Is not can be a permanent like a time. As you are getting benefits, you can start increasing your numbers of breathing. Adult numbers should be 300 at once. If you really want to work and cure yourself very well. Second, if your blood pressure is low, so just block your left nose, use your right nose to breathe. Just like that, smooth time-wise, at least 50 numbers, you will see the difference in your blood pressure. Now, possible you are having cold, serious cold, and you are not able to breathe by nose. So how you can do breath from your mouth if your blood pressure is high? What to do? Tongue should turn inside and breathe in. See here. It will give you cool feeling and you will calm down immediately. You don't need to take any drugs for yourself. You will feel how you are getting light like a water, like you're floating on water. And if your blood pressure is low, that time you still use the same tongue, make a roll your tongue like this. May you hear the force, may you hear the sound, how time I am taking and how time I am giving, how much space I am making inside my body to breathe myself. So if you are in blood pressure issues, try any one technique I just shows you by mouth, by nose. You will see and you record yourself as a video and send to Dr. Susan and you can tell the result. I must say you will say thanks, Dr. Susan, for sure. And now let's talk about sleeping disorder. If you are having sleeping disorder, just and you don't have any blood pressure issue, just at least 50 times from nose, 50 times from mouth. You must try to breathe on your bed while you are going to sleep. Just simple sit on the bed and see here. Like this way, only nose. Inhale, force for exhale. Inhale, slow for exhale. And then after 50, you will start feeling like your head is turning around. Don't worry, it's the reaction. When oxygen take place into the head, is supply of blood all over in your body. Then you start going from mouth, like you're celebrating your birthday. Light a candle, keep far, and see here. 50 times, same like that. When you finish your 50 times from your mouth, you feel tingly vibration all over in your body, from your head till your toes. Means blood circulation has improved very well, and you feel like you are floating on water. You're flying in air. Such kind of feeling come. This 50-50 number I am giving is just for children, not for adult. Remember, but I cannot ask you to start by 100 or 300 number. I will start asking by 50 number because right now lungs capacity are very limited. So as you start doing small, 1 week time, you are able to reach 300 at once. This is my guarantee to you. You can catch my collar, no one give you this word if you are sincerely doing like that. No one medical person can give you such guarantee like that. And now, this is time breathing before going to sleep. So anyone you like it, may you can write note on your paper. Like I mentioned, if your blood pressure is high, block your right nose, use your left nose, inhale and exhale minimum 50 numbers at once. You will see the difference. And if your blood pressure is low, use your right nose to breathe. In case you are having cold, that time you use your tongues and mouth to breathe yourself. If your blood pressure is high, that time you fold your tongue inside in between the teeth like this and breathe from the side lips. So saliva, when you're breathing, saliva will makes you feel like you're putting peppermint in the mouth. and you're having cool air inside your body, you will immediately calm down. 50 number just for beginning, not for good result. 300 for good result. So if you want to avoid your taking medicine for this reason, try that. Within 1 week, you will get result in your hand. And if your blood pressure is low, same tongue, like a pipe, roll, and like this. 50 number just for beginning, not for result. 300, slowly, 50 to 60, 60 to 70, 70 to 80, like that. And if you don't have any issue, just please, my humble request, before sleeping, 50 times strokes from nose. And 50 times from mouth. Also, I just mentioned air, water, fire. These three things create problem. Any one element so high, it is cause problem in the body. Any one element low is cause problem in the body. If you want to balance them, equal, it's 30%, 31%, 33% equal in your body, everything. So that time, please try to use alternate breathing. Alternate breathing also goes by nose, like block your right nose, inhale from left, then block, release from right. Then inhale back from the right. Block, release from left. Again, inhale from left. Block, exhale from right. Say like this. Block, once you are doing breathe like this alternate wise, you may notice 100% you will see your one nose will be very free, like you are breathing like 60% from the one nose, and one nose is giving you only 40%. And this is all natural. It will re-switch by itself after 1 hour time. When you are trying, like say, if you are breathing right now, left nose are blocked, right nose are free. When you check after 1 hour time, 1 hour, 20-minute time, right nose will be blocked and left nose will be open. How our body temperature maintained by them. So this is only oxygen helping us to be healthy. As much as you people increase your level of oxygen in the body, you may always healthy, always happy, no stress can disturb you at all. This is before going to bed. Now, when we are waking up in the morning, so number one thing, when you're breathing in the night on the bed, you are free. Very well. So you are not going to wake up with any anxiety type of things or excitement type of things. Okay, let me do this and that, blah, blah, blah. You will know that. You're just waking up, you will feel relaxed. You will feel released everywhere. Your body will be so much energetic. Without anything, you will feel very, very like smooth and light. That time, what you need to do when you wake up, please try to drink minimum 3 glasses of water if possible. Otherwise, you must take 2 glasses of water. First thing to begin your day. Just good if you are able to drink warm water. Warm water is the bestest medicine. Early morning. Don't even do your brush. Just drink water like your gargle. Drink. don't drink water, you chew the water. Like put, then drink, put, then drink, put, then drink. Just like that, slowly, slowly. So all water called mineral, that all mineral will reach in your all point of your body. It will work with your enzyme, it will work your bacteria, it will work with your everything. It will help them to alive and help you to be strong. Then when you finish having water, after water, just give a break for 1 minute. You are able to sit hands like this, or you can do the same thing while standing like this. Okay, at least 30 times, minimum 30 number of breath. You can use vocal cord to breath, not from your mouth. Vocal cord. See me here, like straight your hands up by sitting or by standing, choice is yours. So see here. Don't rush. Only 30 number. Only 30 number I am asking. I'm not asking too much time. Just 30 number breath makes you same vibration all over in your system. And this simple breath technique is medical proven. It will help to cure your heart attacks and strokes. 90%, let's say 98% heart attack and strokes you will found into the bathroom. Anywhere, your relative, your near, your dear, if you heard about this, somebody having such kind of incident, how come he went to use your bathroom and collapse over there? So before going, just take a small 1 minute break, drink water slowly, slowly, then raise your hands, 30 numbers of strokes. And you will feel vibration again. You might feel dizzy. Just sit down. That's all. When you become normal, when you feel like more lighter, your stomach will ask you go and clean your system. You won't waste time to clean. Instead of sitting on commode and using force, you won't do that. That's cause heart attacks. That cause strokes. So just flush very well. So when your stomach soft, by water support, by oxygen support, you are going to be hungry. So where you people skip your breakfast, no chance you will love to have your breakfast. Because you start treating your stomach. When stomach clear, everything is clear. When stomach bad, nothing can be clear. Nothing can be good. So your stomach is foundation of the body. So that's why stomach supposed to be neutral always. But we are living either positive side or we are living either negative side. So that's why we are confused, if and but always with us. How much time you are neutral? Try to understand. So that is the simple therapy, simple tricks you can use in the normal life to be healthy. It's time, okay? I can continue. Okay, no problem. That's why I've just had people. So these are all natural things. I didn't ask to put any medicine to cure your system. What nature cure, no one medicine can cure. Remember my words. Medicine only suppress your problems. It will not cure your problem. This is number one thing. Okay? Suppressing. One day it will become like a bomb and in a blast, which is create serious issues in the body. Then we are going to so many treatment here and there, do this test, do that test, do surgery, blah, blah, blah. So this is just, I'm not against of that, which is supposed to be last option. We are taking that as a first option. Let nature cure your system. Give small time for yourself to heal naturally. If it's not working, something is weak, something is missing. You take advice from Dr. Susan. Dr. Susan always give you the advice what to eat. Number one thing, your food is your energy. And on time to eat, that is second best thing what Dr. Susan are doing in this country for the people. So while you're treating yourself like that way, it will work very well. So this small technique you can try on your own and listen yourself. What your brain can diagnose, no one device can diagnose. So your brain give you 100% accuracy of the issues where you can explain, but no one machine can give you 100% accuracy. So just give small time. I'm not asking too much. Don't be panic. Just give small peace time yourself. Understand your mind, understand your body, listen to your body, and go as per advice. But advice still take time. Just what is the best advice? Immediate, whenever you are under problem, start oxygenating yourself. That's the best key to make you healthy. And if you are not able, so keep a pepe in your pocket. Whenever you're in problem, eat the pepe, chew it very well. So what will happen? That pepe has some kind of element inside which is help to work for your heart, help to work for your blood. Okay, so when you have pepe, what you do? Don't drink water, just breathe. You will be see normal within 1 to 3 minute time. That's how oxygen helps people cure health wise. So I have to admit that, huh? So if you are, so please, anybody having, let me just not take your too much time for now. I love to know whether anybody having any question or anybody having any issue to, I can help in something.
Hello.
The question.
Hello.
Yes, please.
Ó ní
Can you take
gbogbo
us
nǹkan tí yẹn sọ ló fẹ́
little
against.
more light on
Ó ní nǹkan tó ṣẹlẹ̀ ní
on the
pé
BP and the BP one?
tó ṣe pé nígbà tí bíṣọ̀bù gan sọ pé àwọn máa ń jẹ bí ẹ̀pà kìíní kan lálẹ́ létí lálẹ́ òun wá sọ pé nǹkan tó wà níbẹ̀ ni pé èèyàn lè jẹun ní 8 o'clock 8 p.m. so ó ní 8 8
I just
téèyàn bá
see
jẹun ní
here
8 ó ní 2 hours
who's
after
talking about blood flow.
pé ẹ̀ṣẹ̀ máa sùn so ó ní tó bá ti lè dúró 2 hours but gbogbo kọjá tiẹ̀ náà kọjá 8.
Auntie, please mute yourself.
Yeah, it
I
is
beg.
recorded. I seen somebody asking for last 3 months. I have had to sit for 10 hours without getting up. So that person who is talking about blood flow, it can do one small therapy for 10 minutes. Just put your legs in the warm water for 10 minutes with adding magnesium sulfate powder in the water. 1 big spoon, put in the warm water and keep your legs by the knees.
My
Or
doctor is hosting
to stay like
something
10
about
minutes. You will see the change in it.
Could you please say that
Yes,
again?
it is recorded. It is recorded, I think.
Hello, doctor.
Yes, sir.
I saw some
I
house
said the BP is in the news.
I never went to that one.
Being having headache for some days now, what could it do? Just to breathe. Just to breathe. Just breathe. Oxygenate your brain, please.
Okay, block right nose and with the left nose for IBP.
High BP, I just mentioned, if you are able to breathe by the left nose back to back.
Okay.
Just left nose. Try now. If you are having right now, you just block your right nose. Use left nose to breathe 50 times. And you measurement. If you have measure meter with your blood pressure, just measure it and write on the paper. Then try 50 numbers and you see the result. Then you can understand if you add more and more, how much it will help you.
All right.
Yes,
All
sir.
right.
Okay, so this is 50 times.
Yeah, 50 times, yes. Thank you so much, Bassant.
Yes, thank you.
Yes, you can hear me very well.
Yes, ma'am.
Okay, first of all, thank you so much for doing this lecture. Bassant, you know that in the space of wellness and
Yes.
using natural to stay healthy, I'm not sure I have gone to anybody more than you because most of the things I know, they are mostly inspiration, but you've really helped me in practice. And the last lecture you did in our conference hall, that is why
Yes.
it's very tough for this to be in virtual. So
Yeah.
exercise, and they bring the blood pressure monitoring kit, and you can see someone's BP go from 167 over go straight to 119 over 79. I saw that one with my two eyes in our conference room. So why am I saying this? I'm saying this because let me just summarize especially for those of you who joined late. First of all, thank you so much for coming to our wellness lecture. And as I said before, the whole purpose of this lecture is to create a healthy community. One is also to arm all participants with some techniques that you can use by yourself at home to stay very, very healthy. So that is why, like Bazan talked about today,
And excuse me,
he
ma'am,
talked
I just
about
want to
drinking
mention one
water,
thing.
keeping the stomach soft.
Excuse me,
Go
ma'am.
ahead.
I just want to mention one thing. This all the timing I have given is just a baby step. It's just a baby step. And you are not a baby. Yeah.
Oh, okay.
So
Okay.
yeah. So at your start like a baby, but don't be a baby, please.
Wednesday class together.
Okay, so what Bazant, so what you're basically saying is that everything you have taught us on this platform today is just the baby step, but we are
Yes,
not
ma'am.
going to say a baby. And for your
Yes.
information, the same way I consult
Uh-huh.
Bazant to sit
Yes,
down and
ma'am.
take me through, he's available by God's grace through the clinic, that if you have something that you want to get rid of using oxygen therapy, he can actually help you. He is in our clinic. Anytime I call him, he's ready to listen to our client. But so what I was trying to say is that the whole purpose of this lecture is to arm you with some small tips that you can use to keep your body healthy. Bazan talked about rest, that is sleeping. If you're not sleeping, you cannot be well. So one of the things I learned from you, Bazant, is that when you want to go to bed, the oxygen therapy that you should do is you lie down on your back, you breathe 8 times, right?
Yes,
You
ma'am.
turn to your right hand side, you lie down, you breathe 16 times.
Yes, ma'am.
And then you now turn to your left, you do the deep breathing exercise 32 times.
Yes,
But
please.
sometimes before you get to 32, you've already slept off. And that can help anybody with insomnia.
Best remedy.
Okay, perfect. So if you're
Yes.
having, for those people who are having difficulty sleeping, you can repeat that cycle. So you just lie down straight, you take your deep breath, then you turn to your right. When you're straight, you breathe about 8 times. You turn to your right, you breathe 16 times. Then you turn to your left, you breathe 32 times. Before you know it, you're going to be carried away. And you cannot do this when you have your phone in one hand, because a lot of people will be holding
For
the phone
sure.
and
For
it doesn't
sure.
work. You have to off the light. So
Yeah.
you see now he is
Okay.
talking about rest as medicine. Another thing that Bazan talked about today is about for people who want to just relax and come out of stress, anxiety, and blood pressure issue. So if you're anxious and your BP is going high and you're not getting yourself, he taught us some breathing. He taught us today that you can block your right nose and breathe from your left nose up to 50 times. And you can measure your blood pressure before and after. I'm 100% sure you will see it come down, because this one, we did it in our conference room several times, at least 2 times that I have seen with my two naked eyes. So it's helping. And because every time your BP goes up, the first thing to do is run to take a drug. Why don't you come down with this oxygen therapy that Bazant has taught us? For those of you who have low BP, he's saying block the other nose,
Right.
which is the left nose. and the BP will help to stabilize the BP. Then I think Bassant also said, when you're drinking water, which is water as medicine, you can see we are almost talking the same thing, but he's doing the Indian style, and me, I'm doing Dr. Physics style, but in the long run, we are saying the same thing. Bazan said, when you're drinking 2 to 3 glasses of water, so that 2 to 3 glasses of water is equivalent to what we always say: 2 for breakfast, 2 for lunch, 2 for dinner, 50 cl. So 2 to 3 glasses of water, 8-ounce glasses. It gives you about those 2 bottles, 50 cl bottle when you wake up in the morning. And he said that when you wake up in the morning, you should carry your hand up and do some breathing exercises, drink your water, and you will go to the toilet easily, and you will not easily have a heart attack. And Basant also said that during the day or any time when you're drinking your water, don't just put the water gum gum gum. You have to allow the saliva to mix with the water, so that the water becomes a medicine, have all the enzymes, help with digestion. So you put the water and you shake it in your mouth a bit, just not just to put your water boom, 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 as if you're pushing down some very serious swallow, but you should allow the water to get some saliva, and the saliva is actually pure medicine before you now swallow the water. So I know he said a lot, but these are the ones that I picked very, very clearly for myself, the one I can be using for sleeping, which I must start this night. And I beg everybody to experiment this night on the breathing. In fact, if you do that breathing exercise, tomorrow your BP will be lower. Trust, let's say your BP was high today, because I've tried it in the past. I did breathing exercise before I slept, and when I wake up, my BP is always normal anyway, but it was significantly lower. So for me, so I think maybe it will also work for BP patients. I cannot say, but you can try. But it will give you a very deep, restful sleep. So
Yes,
we have.
sorry
we
to
have.
interrupt you.
Yes, go ahead.
As you're talking about BP and people are on medication, so people are taking BP medicine. So they are taking, somebody coming and dropping in the medicine in their mouth. Is it? So I'm just trying to tell them, keep the medicine side and just breathe. That's all.
That's all. That's all. So what Bazant is telling us tonight is that because we are not getting adequate oxygen into our system, this is why we are not our health is compromised. Hello, are you there? Can you hear me? Okay.
Yes, we can hear.
Are you tired of hearing me? I've stolen
No, we can hear you. Thank you, ma'am.
I have stolen somebody's presentation.
Please talk. We hear you.
Thank you, sir. Okay, so that is just, I just wanted to join Bazant and say thank you so much for all the things. So if you have any further questions, we can take it.
Thank you so much, ma'am.
You're welcome.
Okay, so I have a question.
Go ahead.
So I wasn't quite clear when he said you should do 30 breaths with your hands held up over your head. He demonstrated it, but those 30 breaths, is it through your mouth or through your nose?
Mouth.
And is it
mouth. I said
through the
vocal
mouth?
cord. This vocal cord. I'm not even saying mouth. I didn't even say nose.
Okay,
I say
vocal cord.
This
Okay,
vocal
I didn't
cord.
get that.
Uh-huh.
Okay, so you breathe. Okay.
You can try right away. You will see what I am doing.
Basant, is it okay if everybody does the exercise together?
Yeah, why not? For sure.
Okay,
Let's say
so
this small. Let's say this small. And we talk about. Let everybody raise their hands up.
Okay.
Open your mouth and breathe from vocal cord. I want to hear 30 times. See here. Are we ready?
Yes.
1, 2, 3, 4,
When do we stop now?
5. Are you guys tired?
No.
6. Go ahead. 7. Vocal cord to use.
Okay.
8, 9, 10, 11, 12,
Oh.
13, 14,
No, Susan, you can't be tired.
15,
Everybody know.
16. Carry on, carry on. 17. I want to hear the sound. 18, 19.
Bassant.
Go ahead, go ahead. 20. 10 more to go. 21, 22, 23, 24, 25, 26, 27, 28, 29, and 30. Impression. Number 1 impression.
Ah.
You will start laughing yourself.
I'll go there and do it. I thought Susan like
Your all happiness comes from inside you, not from outside. We didn't crack any joke.
I think it's waiting the long.
Second impression, who did
Thank
it
you,
very well?
Jesus.
They will start yelling like that.
It's waiting the long when you are doing it.
When you
Okay.
have done properly 30 numbers, you will do back to back like that. So you
Okay.
can
So
and
for
the
those,
simple reaction I mentioned, you feel dizzy, you feel drowsy.
yes.
Very common where you are supplying oxygen in your whole system from head to toe. Not only hair. That's why I mentioned
Somebody
if you do.
said, I'm feeling dizzy, I'm
Yeah,
holding
I
on.
mentioned
Like,
already.
just sit down and drink water. That's all.
No need to drink water. Just sit down or lie down. Nothing to be
Okay.
wrong.
Okay. So what Bassant is teaching us this night is that when you're doing that exercise where you lift your hand and you do up to 30 times, what he is saying is that you're likely going to feel dizzy in your head. Just sit down and relax. It means that the oxygen plenty is getting to the brain. And like for those of you that take oxyvite therapy,
Oxyvite. That's right. When you take oxyvite, yeah.
that is what happens. So this is
Mhm.
a clear example that when you have a lot of oxygen in your body will be like, where is this oxygen coming from? And things will rearrange in your body, your BP, your sleep, and things can get corrected. Honestly, it's
Sorry,
a practitioner of this oxygen therapy, and it's really helped me a lot, especially to manage stress. And I just thought Bassant can help us today. Thank you so much, Bassant.
Thank you so much, man. Sorry, you see that makes you blank. When you do 30 numbers breathe, it will makes you blank. That dizziness, that drowsiness makes you feel disconnect from everything. You will not think about your children. You will not think about your business. You will not think anybody. You will feel yourself. Your mind analyze everything where and where what is happening. There's no side effect. You will become normal within 1 minute. But you disconnect from everything, and that is means your time. This is you and your body need. Otherwise, you are always engaged your mind with something and something.
Yes.
So when you engage with hidden enemy, how you can heal your problem? That's the hidden enemy. When you cannot see, only thinking, they are in your brain.
Doctor, this one is used for sleeping. This one
is
for
from
sleeping.
waking up. When you wake up in
in the morning.
I'm not talking about morning. I'm talking about the one for night. The one for night. If you lie down by side, you breathe from your nose and breathe out. Is that what you do?
When
Okay.
you're breathing 8, 16, and 32. Bassant, how do you do the 6, 18, and 32? How do you breathe that one?
Just by nose, by mouth, whatever.
Okay.
God has
Okay.
created resources.
Doctor, to reduce this one that will block one nose to bring down the BP. Is it the right nose we block or the
No,
left nose?
depending on BP.
For bringing down the BP, you block the right nose.
Right nose and use the left nose.
Yes.
For low BP, you
That
plug
everybody wants to bring down
left
left nose.
left
But
nose.
just if you remember one, you remember the other. If you want your
Yes.
BP to come down, you do the right thing. And the
Right.
right thing is the right nose.
Of course, automatically the other one is the left. If you are going to go low.
Automatically, the other one will bring down.
Okay, that's a good one to help remember. Yes.
Yes.
So if you want your BP to go down,
and
the
with
right
this
thing.
you do the right thing, and the right thing is the right nose. So you block it.
Yeah.
So that's how I remember. Okay.
Somebody
One
like,
last
how
thing.
do I bring down blood sugar? Just stand up on the toes, up and down 120 times. You will
Okay.
see.
One. Oh, okay. Bassant, you said something about the standing on the toe up and down. I'll give you a minute to say that. Once again, for those of you that are just joining, because I just noticed that some people are still just joining. I don't want you to miss out. What we have done in the past hour is to equip what we do every Wednesday is to equip our with some practical wellness techniques. That is the objective. And we teach things like how to rest better, how to sleep better. Last did a topic on supplements. Should you even supplement in the first place? Which one you should use? We do on your mind as medicine. We do on water as medicine. How to the same way we are teaching on how to use oxygen to treat a lot of stuff. We also talk about water, how to use water to get rid of all the elements, small things you can do at home. But the most important thing is that everything has validated. It's not you can bring it to the public. And I want to add that if you want to have a private section with Bassant, as long as you're in Abuja for now, because I know right now there are people coming from South Africa, Canada, US, all of them are on this line. You can consult Bassant directly. He's also very good with getting people out of wheelchair, especially stroke victims, etc. All that kind of long term. He has things that I don't know how he does it, but Bassant, I respect your work and I want to thank you for sharing this for free. For free. You did not charge me any amount of money. You know that I do this for free also. And you said, you know what, Dr. Susan, I will encourage you. I know I cannot afford you. So I want to say thank you.
Come on, man.
Thank you so much. I appreciate you. Thank you.
Thank you, Dr.
All right.
Bassant.
Thank you so much, man.
Dr. Susan.
Thank you.
Thank you.
Thank you all. Thank you
Thank
all.
you, Dr.
Thank
Alde.
you.
Thank you.
Thank you so much.
Just
We
one
I
appreciate
need to go.
uh,
Thank you.
doctor said to, so we will drop the recording. Please, I want to ask as a big favor, when you listen to our recording, please like us or something. I think it's like, because if all of us either like and share or something, we will be able to have a big enough audience to be able to do YouTube videos instead, because it will be so much easier for everybody to connect to YouTube video. But it's us that will build up to be able to do that YouTube video. So we will drop the recording on the platform and give you a link to the YouTube, and then you now click and like and everything. So yes. So once again, thank you for attending. Later is usually not like this. Today was supposed to be practical, and because we've talked about the numerous benefits of even recognizing that you're breathing, even recognizing that you're breathing. You know, we've talked about how we can use oxygen to reduce BP, to do this and that. But by God's grace, today we have seen it practically
Better.
how it can be done. So we can't do everything in one day. So just little by little. Today may not be your class. Next one might be on sleep. Next one might be on food. Next one might be on infectious disease. We are going to do one on erectile disorder and sexual health. I've been postponing it because I have a lot of information on sexual health. One of these days, we will also do that. Small. But what I guarantee you is that if you spend 1 hour, only 1 hour in a week, within 1 year, you're definitely better off than somebody who did not spend the 1 hour once a week to just enhance the most precious asset which you have, which is your health. So once again, thank you so much, and God bless you.
One last question, please. One last question.
Go
Can
ahead.
oxygen help you lose weight?
100% yes. So when you're doing your breathing exercises, you're relaxing. When you're relaxing, your cortisol levels and your stress hormones are reduced. Remember, when the stress hormones are high, you're inflamed, you're more acidic, and you're more likely to be depressed and maybe eat what you don't want to eat. So when you're doing deep breathing and relaxation exercises with oxygen, you have your mind sound that you might just be happy breathing the oxygen. It will decrease food craving, and it decreases inflammation, and it decreases the secretion of cortisol levels, which is a fight or flight hormone. So yes, breathing oxygen can actually help you to lose weight also.
Okay, thank you.
Please, doctor.
All right,
One question, please.
Go ahead.
Can this exercise help diabetes patients?
You know what? If Oxivite, which the one we give as injection, can actually help stabilize the pancreas enough to secrete insulin better, and you know that I don't know whether you know, but 100% of patients who use Oxivite in the clinic, that seeing a lot of improvement, then I believe that it can help, because the whole idea of this oxygen therapy is just to, what we do in Dr. Physics is to restore the body's innate ability to heal itself. So directly, I cannot say oxygen, maybe 100 will decrease sugar. No, I cannot say that because I've not seen, like I said, anything we say here is 100%. We have seen it over and over, and it's safe. But I will look at, what are direct techniques. I know that there are some hand techniques, certain parts of your thumb that you can press, and it can enhance insulin secretion. But in terms of breathing, I'm not sure, but just know that generally it will re-regulate your body, and it will help things to happen normally. But I cannot say directly that it will instantly crash your sugar. No.
Okay. All right, thank you.
The joint technicians and the AAA. Okay, YouTube, and just even if you don't look at the whole video, just like and share so that we can get the number, so that we can start doing this on the YouTube. And God bless you once again. Have a good night, and don't miss next Wednesday, because next Wednesday is going to be hot like fire. And thank you so much. Have a good night.
Good night, and God bless you.
Good night.
Thank you. Thank you so
Good night,
much.
Dr. President.
Unreservedly apologized for it. That was a remorseful jam registrar at a news conference.
This admission of culpability follows an avalanche of complaints by parents of UTME candidates who failed the examination and the unfortunate suicide of a 19-year-old student in Lagos who killed herself after receiving a score of 170 in the examination. JAMB attributes the error to a system's failure and is apologizing to students and parents for the trauma caused.
We deploy our system to the use of high-profile organizations within and outside Nigeria as part of the broader strategy of ensuring that everything works well when we need it to work. Part of our preparation for this year, we updated our system from form-based to the single item-based examination, the latter of which is the in-thing presently international. We simulated this system, streamlined our Autobot and auto system, and still went ahead